Decisions about care should be made by a qualified person, a qualified professional, not a computer algorithm with no human capacity. The current system allows an algorithm to determine outcomes without any capacity for a trained assessor to override it. This bill ensures the tool supports, not replaces, professional judgment, and it enshrines it in primary legislation. The integrated assessment tool should be a tool that assists assessors, not replaces professional judgment. The bill achieves this in three very practical ways. First, it restores the discretion of qualified assessors to override or adjust an algorithm's recommendation where their clinical judgment tells them that that outcome is wrong. Secondly, it improves transparency by requiring decision notices to explain how the algorithm was used and how the assessor's professional judgment influenced the final outcome, giving older Australians greater confidence in the process. And thirdly, it creates a right for people assessed since the 1st of November 2025 to seek a fresh assessment if they believe the algorithm produced an incorrect classification, ensuring people are not locked into decisions that have been wrong. This bill responds to significant concerns raised by assessors, advocacy organisations and older Australians that the current system is failing to accurately assess people's care needs. It recognises that no algorithm can replace the experience, judgment and clinical expertise of a trained assessor when making complex decisions about an older person's care needs. The bill strengthens accountability by making the assessment process more transparent, and importantly, this is not about changing eligibility or increasing funding levels. It is about ensuring the existing assessment system produces fair, clinically sound decisions about an older person's care needs. The department confirmed in estimates in June 2026 that the algorithm was never tested as part of the live trial in 2023, was developed and tested internally only within the department. There was never any consultation, the tool has never been clinically validated, and the decision to remove human override was a budget decision. If the government is genuinely committed to protecting older Australians, it should support this bill this morning and enshrine human override into the primary legislation. Our bill provides lasting protection by embedding the right of qualified assessors to exercise their professional judgment in primary legislation, ensuring future governments cannot remove human override without proper parliamentary scrutiny. We know what happens when those protections are absent. The government removed human override without consultation with either assessors, providers, older Australians or their representatives. Decisions of this magnitude, decisions that determine the level of care an older person receives, should never be made behind closed doors or altered by regulation alone. They should be subject to the full parliamentary oversight and accountability of this place. So, for thousands of older Australians who've had their care packages slashed or been deemed ineligible altogether, even as their conditions deteriorate and worsen, we will support you. Families and frontline assessors are watching vulnerable seniors denied the support they need to stay safely in their own homes. This is not the person-centred, rights-based aged care system Labor promised the Australian people. Minister Ray's rapid review is a damning admission that the tool is failing, yet he has ruled out reinstating human override while only tinkering around the edges. Labor has failed older Australians on every single turn. Their reckless algorithms first approach is driving assessors out of the sector in droves and leaving older Australians worse off than they have previously been. This is just another example of how the Labor government is leaving older Australians behind at a time when they are most vulnerable. Older Australians have told us that they want this bill passed, and their families have asked for it too. And unlike the Labor government, the Coalition and others in this chamber have listened, and we will act.
Straight out of the Senate, Anne Ruston just tore into Labor's dodgy aged care algorithm, and she's spot on. This isn't some minor tech glitch. Since November last year, a computer program with zero heart has been deciding how much help older Australians get to stay in their own homes. No trained nurse or assessor could override it, even when it was clearly wrong. Families watched loved ones' care slashed while their conditions got worse. Ruston nails the three fixes in this bill: give real professionals the power to step in when the machine stuffs up, make the decisions transparent so people know why they're getting screwed, and let those assessed since November get a proper fresh look. She points out the algorithm was never properly tested in the real world, never clinically validated, and the decision to ditch human judgment was just a budget cut dressed up as progress. No consultation with providers, families, or the experts on the ground. Classic Canberra: decide behind closed doors, then act shocked when it hurts vulnerable people. This is exactly why Australians are fed up with big government solutions that sound smart on paper but fail real families. Older Aussies aren't data points. They built this country. They deserve experienced humans making calls about their care, not some unaccountable algorithm chasing savings. The cross-party push, Coalition, Greens and Independents, forced Labor's hand. They scrambled with some half-measure tweaks right before the vote, but it's too little, too late. The Senate passed the bill. Now it's up to the House. Ruston's message is clear. This isn't about more money or changing eligibility. It's about basic fairness and stopping a flawed system from leaving seniors worse off. Families and frontline assessors are watching. Labor promised person-centered care. Instead, they delivered algorithm-first cruelty. Time to put people back in charge at the Senate.